Hi everybody, welcome to Better Health Together, and you'll note I have sitting next to me Dr Tim Koh, who's a practice owner of Ocean Keys practice in the northern suburbs, but also the operator of the Clarkson Urgent Care Centre. Some of you might be aware that the Commonwealth announced 7 urgent care centres in WA. Clarkson is one of those. And I have to say, fascinating experience in recent weeks, not only standing up the urgent care centre, but now your experience in operating it. I imagine people would really want to hear from your perspective, lessons learned, looking back, coming to where you are today.
Leanne, thanks for having me. It's nice to be here. It's been a whirlwind of 2 months of getting a new urgent care clinic set up from scratch. It is part of our practice, but it's separate to the practice. We've just sort of dipped our toe into the experience of GP-led urgent care is how I would describe it.
The genesis of the urgent care clinic model was to reduce pressure on hospitals, particularly emergency departments. And my understanding is, from your experience to date, you've been incredibly busy.
It surprised me how much work there is for urgent care. And a lot of the work really reminds me of when I started in general practice 20 years ago, where GPs were perhaps operating perhaps a little less busily, and we would be able to see sort of squeezing patients with things like cuts and lacerations, sports injuries, even sick kids with an ear infection, which would be our most common presentation. We kind of stopped seeing them unless you were sort of a new doctor in a practice as you built a sort of load of sort of more chronic older patients. So for me to go back to doing that again, I've realised actually how much I enjoy looking after sort of that acute and urgent care. It's good fun, you feel like you make a difference, and it seems to really help the community, helping people have an option that's not going to hospital. So they're getting looked after in the community.
There's 2 or 3 sort of key points in what you're saying. One is, from a job satisfaction perspective for a GP, it has real benefits. You're doing more and different things as well as what you normally do in your practice, but also for the patient or the family. Gee whiz, you wouldn't want to take a child with an ear infection and sit in an emergency department. You'd rather be seen in a local practice and get some immediate care that's going to relieve the issue.
Yeah, I think so. I mean, certainly I would absolutely echo what you say about the GP experience. I think for the doctors, it's going back to generalism. So it's allowing us to work with more scope and do things that perhaps we haven't done for a long while. Things like suturing, plastering, things that a lot of us have sort of just haven't had the opportunity to do. So it's become really enjoyable, and it sort of enhances the generalism of general practice. And then, for patients, there's that sense of connection with GP, and that I think does make a difference. It's making people feel like they're understood as people, yes, even when they're in an urgent situation.
And going forward, it would seem like that both of those perspectives are the enabler for your practice to adapt and change with this new model of care, for want of a better term.
It is that there's the need for change, and there's that desire amongst our team to try something different and make a difference with our community. I think our practice has very much been an asset into the community. We'd like to enhance the other practices and really help them look after their patients.
Clarkson UCC has now been operating 2 months, thereabouts. What have been some of the highlights for you?
Well, firstly, the wonderful team of staff that we have and the journey that we've gone with educating us and learning about urgent care. For me, I think re-embracing some of the aspects of general practice that perhaps I haven't seen for like 10, 15 years. Things that actually I really enjoyed in general practice. And a lot of patients, they'll say, thank you so much, you've saved me a trip to hospital, or, it's been a really great service.
Just one last question, and it's really about how do you operate as an urgent care clinic when many of the people you'll be seeing in that clinic also are patients of other practices?
It's a very common experience. We really have worked on trying to stay engaged and continuing to be an asset to the local practices. So we're not running in competition. And I think for us, a big part of that experience really came from the fact that we ran a COVID testing clinic, and local practices could send patients to us, and we were able to sort of assess them and look after them when GPs couldn't. It established a sense of trust that we would look after patients and hand them back in an appropriate way. And that to us is the really important thing, that We're simply there to look after the encounter with the patients and encourage the ongoing care to continue with the regular doctor.
That's really important. That's been a great overview of what I think has been a fairly complex model to stand up, and your service has done that. Thank you so much, Tim, for being available, and thank you for all your work and commitment to both not only your colleague GPs in enabling them to be more generalists, my words, but also your contribution to the community. It's to be congratulated, and thank you very much.
Thank you, Leanne.